Well, last month, 7 investigators showed you how nurses inside McLaren Macomb were blowing the whistle on what they said were unsanitary conditions and a lack of COVID-19 protocols inside the hospital. That story sparked a social media firestorm, prompting thousands of shares and comments from patient and employees detailing similar concerns. Well, tonight, 7 investigator Heather Catallo joins us live with a look at a new investigation that is now underway. Fill us in, Heather.
That's right, Carolyn. I've just confirmed the Center for Medicare and Medicaid Services has asked the state to launch a probe based on our original story that aired last month. And tonight, patients and more employees are coming forward. Stacks of soiled linens, overflowing garbage cans, dirty bathrooms, and messy floors. Those are just some of the cleanliness problems inside McLaren Macomb that employees and patients have alleged to the 7 investigators.
It is very dirty, that it is not clean, it is not being sanitized. We have 2 housekeepers on the day shift for a massive emergency department. After 3 p.m., 1 housekeeper is shared for most of the hospital.
In May, nurses from McLaren's newly remodeled emergency department came forward alleging COVID-19 protocols were not being followed inside the ER. They asked us to hide their identities because they feared losing their jobs.
The experience was the most awful experience I've ever experienced in my life in the hospital.
Christine Saunders says she spent more than 36 hours in the ER back in March before being moved to the COVID-19 unit at McLaren Macomb.
You can immediately smell the stench. It was disgusting.
Saunders says she thought she'd be isolated as a COVID patient, but instead, she says, a woman with a 104-degree fever was put next to her in her room. Saunders says the other patient was unable to control her bowels and alleges the staff would not let them keep the door to the room open.
The smell was absolutely disgusting. I couldn't even take it, but not even with 3 masks.
How long did you have to sit in that stench?
A good 2 hours.
And no one came to clean it up?
Nobody. And I kept ringing the button.
Saunders alleges the conditions inside were so bad, she checked herself out of the hospital in the middle of the night.
It didn't look like they had anybody keeping up with the rooms or they didn't have enough staff.
She then filed a complaint with the hospital, and she also says she filed formal complaints with the state of Michigan and the Joint Commission, which provides accreditation to hospitals. McLaren Macomb employees have been filing complaints with the state as well. Since the start of the pandemic, the Michigan Occupational Safety and Health Administration, or MIOSHA, has investigated 9 different formal complaints from employees about the hospital. While some of those investigations are still underway, the 7 investigators obtained the closed complaints through the Freedom of Information Act, as well as other records. Some of them are about lack of PPE at the start of the pandemic, which was a problem at many hospitals. But more recent complaints allege COVID-19 patients are not isolated and their rooms are not sanitized in the ER. The hospital is not taking patient temperatures before moving them to rooms, potentially exposing others to the coronavirus. Restrained patients are not being monitored due to excessive patient load. Patients on ventilators are not being monitored. IV fluids placed in a blanket warmer, elevating the fluid temperature to a dangerous level. The medication refrigerators are alleged to be disorganized, increasing the chance of a fatal drug mix-up. Fit testing of respirators is not up to date, and allegations McLaren isn't testing patients for COVID if they've been admitted to the hospital. In all the completed complaints provided to us by the state, MIOSHA closed the investigation after receiving written documentation from the hospital. The state considered the hospital's response satisfactory each time, but no one from MIOSHA ever went on site to inspect the conditions in person. A MIOSHA spokeswoman says doing inspections via letter is a normal practice, but McLaren nurses call that disturbing.
We're crying out to them, please help us. And no one's coming.
Dina Carlisle is the vice president of the nurses union at McLaren Macomb.
We continue to make these complaints to the hospital regarding these issues, But who ultimately do they answer to?
Now, another government agency is investigating these allegations about McLaren Macomb. Since the start of the pandemic, the state's Bureau of Community and Health Services has received 35 complaints about McLaren Macomb. 26 of those were either closed or referred to a federal or outside agency for further investigation. 6 of those complaints were filed after our original investigation aired in May, including one initiated by the Federal Centers for Medicare and Medicaid Services, or CMS. State officials confirm CMS asked the state to launch an investigation after seeing our story.
I think that patient safety is my priority. It's part of our duty to all work together and have a great environment for our patients and for the staff to work there.
Now, I have asked multiple times for an on-camera interview with somebody from McLaren Macomb to discuss these allegations, but McLaren officials wanted our questions in writing prior to that interview, which is something we ethically do not do for anybody. Now, just moments before we came on the air, they did send us some statements and some photographs. We'll have those for you at WXYZ.com. Reporting live in Mount Clemens, I'm Heather Catallo. 7 Action News. Carolyn, back to you.
Good job, as always, getting to the bottom of it, Heather. Hopefully changes are coming. Thank you. I know you'll continue to follow it.